All right, so what's your name and what you do for a living?
My name is Lisa Kwan, and I'm a physical therapist.
So how long you been practicing?
This is my 18th year.
18th year,
Yeah.
all right. So what kind of treatment you used to use on your patient? What manual therapy you used to use?
I did a lot of strain, counter strain, a lot of kinesio tape, a little bit of cranio, sacral, a lot of core stabilization, Pilates. You know, I like to educate the patient. Of course, Therax. Yeah, and stretches, and I didn't realize the things that I learned about stretches in this class.
Yeah, so you very well now rounded with the classes that you taken. That's good, awesome. So what made you decided to take ASTR class?
Well, multiple reasons. I really don't like to create pain in patients. I need patients to feel confident in me when I treat them and trust me. So I wanted to find something that was non-invasive, and that's why I was really interested in strain counter strain. I was practicing that for a while because it didn't create much pain, not at all. But I didn't get the results that I wanted, you know, the long-term results. The other thing is I have a lot of loved ones in my life that I feel like I have a lot of experience, but I can't help them. So a lot of that is to not only help my patients, but people that I really, really care about.
Yeah, help your family. So what's your thought about ASTR class after you finish in the class?
I really like it because I have a science background, and research is really important to me. You know, to the fact that you showed us that, you know, there were many, many studies that involve the whole biopsychosocial model, and that this is really different from any of the classes that I've taken, because I haven't incorporated, you know, the whole body as a whole.
So have you had ASTR treatment on yourself, and did you were experiencing pain before the treatment? What you're experiencing as a patient, as a physical therapist after receiving ASTR treatment on yourself?
I had some pain around my orbital area around here, which is gone now actually. I had some headaches. So I was surprised by how little force you need to exert to get an effective, quick result.
So do you have headache now or pain or?
No.
All
no,
right.
And then just right now I felt a really great vote of confidence when I helped a patient with their range of motion.
Yeah, so tell me more about your experience as first patient you're working on today, like as a patient and as a practitioner too. So what's your experience for what you just did a few minutes ago?
Oh, okay. Well, my experience is that I saw with my own eyes the difference in the before and after, the range of motion in the hamstrings, unable to touch the toes before, but then now he can almost touch, you know, with the palm of his hands the floor, and I really didn't spend much time. So
how long did you spend on him?
I probably spent 5 minutes.
5 minutes, and you get 4 range of motion in 5 minutes. How long it's usually if you use the old technique to get that range of motion?
Forever.
All right. Yeah. Awesome. Yeah. So after finishing the 3 days course, ASTR course, what do you think? Do you feel you are confident to implement the ASTR methodology and use the instrument tomorrow on patient? How do you feel?
Yes, definitely. Definitely after I've seen the results that I just did on another student, I can see the difference.
Do you feel you're confident? You confident that you learned the material very well now?
Yeah, I do. And then I do want to review more on the nutrition part that I have. This is the first time I've incorporated nutrition into physical therapy, so that's something that I want to learn more about. But as far as the instruments and the manual, that's something that I can easily practice the next day.
Beautiful.
Today, right now.
Actually, awesome, yeah. So what would you say to other colleagues like physical therapists, chiropractor, or occupational therapists? What you will say about the ASTR class?
I would say it's different from everything that I've taken because it involves the whole body. It is backed up by research, and it is effective, and you see results immediately.
Yeah.
So
Awesome.
yeah, so I would really recommend it.
Awesome. Thank you so much. Thank you.